Good medicine. How medicalization has reshaped human health. Let's begin by breaking down some of the terms here. Medicalization occurs when a non medical condition or state becomes medical. Now that they've become a medical problem, they are based on a biomedical model of disease which views behaviors, conditions, and illnesses as a direct result of malfunctions within the human body. Human beings are the physical substance of the human organism, composed of living cells and extracellular materials that are organized into tissues, organs, and systems, or at least that's the technical definition. We are beings that are born and continue to grow over our lifespan. We're able to perform our daily tasks for the most part. However, sometimes small things like bacteria, viruses, parasites, and fungi like to attack our systems, which leads us to fall ill or to have a disease. Bayer explains that recognizing a condition as a disease or disorder and having it treated to improve the experience and quality of life of the affected individual is a key benefit of medicalization. Let's take a look at medicalization in history. Reynolds explains, back in ancient Greece and Egypt, medicine, magic, and religion were intertwined. Due to the lack of information on the human body, particularly the nervous system, there was an assumption that the cause of hysteria was linked to the womb. Werner explains, the ancient Egyptians believed that the woman's uterus was a rogue organ that was able to migrate around her body and cause abnormal effects. The clinical practice and epidemiology in mental health reveals how hysteria was previously treated with herbs, sex, sexual abstinence, some form of punishment, or purification with fire. It wasn't until the 17th century that hysteria became linked to the brain, and finally, in the 19th century, we discovered that it occurs in both men and women. The medicalization of hysteria allowed for people to understand the scientific facts behind hysteria and revealed that it does not only occur in women. This provided a significant advancement in medicine, as well as a greater understanding of the human brain. According to the clinical practice and epidemiology in mental health, the development of these disorders appears to be a factor connected to social westernization, and exploring under what stipulations the symptoms first became common in different societies became a priority for recent studies over risk factors. When illness is being socially defined, the symptoms are identified based on the physical or biological state of the person that is affected. From there onwards, research begins to determine the origin, prevent transmission, and to eventually find a cure. Modern medicine has allowed for discoveries of and cures for many diseases that people of all age and social groups were suffering with before. Alzheimer's is a neurodegenerating disease that gradually worsens over time. People that are affected by it often have trouble remembering events, problems with speech and language, disorientation, and behavioral issues. Alzheimer's was previously linked with senility, but is now treatable with drugs. Similarly, children with ADHD were previously considered normal kids with poor behavior habits until they were diagnosed and medicalized. The medicalization of erectile dysfunction in men has also led to the discovery of various therapies to enable men to have a normal sexual life. Treatments such as Viagra are now accessible to men. But what does it mean to have a disease? Merriam-Webster defines a disease as the impairment of the normal state of the living thing that interrupts or modifies the performance of vital functions. But how do we determine what normal and vital are? Both these concepts are socially constructed, and all diseases are experienced differently based on your particular social world. Conrad admits that medicalization has made significant contributions to the welfare of human beings and can be viewed as social progress. Conditions of the past that were either mistreated or ignored now have cures, and people have access to it. Individual blame has significantly decreased in conditions such as alcoholism and ADHD, and many other forms of medicalization, such as Alcoholics Anonymous and rehab, are beginning to even decrease the stigma associated with these conditions. HIV is one of the most common hybrid biomedical and social diseases to exist. It is a biomedical disease because it is caused by a retrovirus, which results in immune deficiency as opportunistic infections take control. It responds well to medications, but the medications can only suppress symptoms. The infection is not yet curable. It falls under a social disease as well because of its mode of transmission and acquisition, in which bodily fluids are exchanged heterosexually, and because of the stigma and prejudice that often surround people living with it, as expressed by Bayer. However, the medicalization of HIV has significantly decreased mother to child transmission during pregnancy, as well as overall mortality rates. Preventative measures can be established and taken as a result of the medicalization of a disease. By receiving the antiretroviral prophylaxis, women can reduce perinatal transmission of HIV. The medicalization of the human body provides benefits in terms of medicine, healthcare, and a better understanding of infectious diseases that can be fatal. Through medicalization, we have been able to eradicate a plethora of diseases, decrease mortality rates and surgical deaths as we have greater knowledge of the human body and medicine, as well as an overall increased and healthy lifespan. Medicalization of conditions also grants for funding for further research as we are continuously learning about new diseases.